Welcome to MFP Live. I'm Donna Ladd, the editor of the Mississippi Free Press. And as always, my partner and co-founder in the MFP, Kimberly Griffin, the publisher, is with us tonight as co-host. Hey, Kimberly.
Hello.
And we're really excited. We have a big show tonight and a lot of brilliance for you guys to talk about some really important issues in the state of Mississippi and what these gentlemen have been up to. I was just telling them I was thrilled that all three of them agreed to be with us tonight. And so it's really going to be a super show. So quickly, we have Dr. Victor Sutton, who is the director of the Office of Preventative Health and Health Equity at the Mississippi State Department of Health. Hello, Dr. Sutton.
Hello.
And then we have Dr. Chigozie Udemgba, who is the director of the MSDH Office of Health Equity. Hello, Doc. How are you?
Hello.
And then we have Damion Portis, who is the owner of Clean Joker's Master Barber Art Studio here in Jackson. He's also a marketer and graphic artist by trade. And he's into investigating his clients' health, which is kind of a hint about some of the things that we're going to talk about tonight. Welcome, Mr. Portis.
Thank you for having me.
So what I thought we would do just really quickly is to get each of you gentlemen just to give a little mini bio of yourself. I know that we're statewide and our viewers, I think, like knowing a little bit of background on where you are or where you're from. If you're not from Mississippi, maybe a little bit about how you ended up in Mississippi. So why don't we start with you, Dr. Sutton?
I'll be glad to. Again, Victor Sutton, and I'm actually here in the Jackson, Madison area, and I've been working with the health department for quite some time. Native from Mississippi, actually born in Pasadena, but moved here at a very young age. So I kind of call myself just a Mississippi boy. Just really been involved with programs surrounding health and health equity and health disparities, and looking at programs in leadership and some of those kind of things. And so just really excited to be here, enjoy public service. I always felt that public service is a privilege, and have kind of moved myself towards that area for quite some time. So happy to have a discussion a little further, but that's just a little bit about myself. Married with a couple of kids.
Thank you, Dr. Sutton. How about you, Dr. Udemgba?
So I am Chigozie Udemgba, and I'm originally from Natchez, Mississippi. Grew up in Natchez, and I'm currently living in Jackson, working for the state. My family's originally from Nigeria, and so it's like Dr. said, it's been great to work in public health and take this opportunity to utilize my skills and education to really give back to the state of Mississippi. We know how important health equity is, and the work that we're doing is really trying to close the gap on a number of different things. And so it's great to have such a great team with Dr. Sutton and Mr. Portis continuing to do this work and really try to give back and make those connections across the board.
Thank you. Welcome. And then Mr. Portis, tell us a little about yourself.
Okay, Damion Portis. I'm a native of Jackson, Mississippi, high school, elementary. All my schooling was right here in Mississippi. I actually went to Tuskegee University for a brief period, finished up at the University of Southern Mississippi in marketing and graphic design. And after that, I got a degree in our certification in barbering because I cut hair throughout college. And so doing a brief stint in graphic design and marketing, which I still do, I also wanted to add to my repertoire, really taking into the whole grooming of a person outside of their business, photography and business cards and whatnot. I wanted to go ahead and add my barbering skills to it so that when I sit with my clients, I'm able to take care of not just their look, but I can also help with their business. And that even involved into my own personal health and the health of my clients. So thank you for having me. I'm glad to be here.
Great. So I'm going to set the table about why we're all here tonight and then kick it to you gentlemen. So all three of you talked to Nick Juden, who's a reporter at the Mississippi Free Press, about your work together and how you're collaborating over health equity, and particularly around vaccine disparities in the Black community and more. I mean, you'll tell us more about that. But I pulled out of his story here, in the earliest days of the vaccine drive, Black vaccinations in Mississippi were lingering below 30% of the total, right? And with the population, that's 38%. But since then, Mississippi has broken through these barriers of disparity. A Kaiser study, he said, in like mid-October, found that Mississippi was one of 6 states, including Oregon, Alaska, Idaho, Washington, and Louisiana, that showed a higher rate of vaccination among Black residents compared to white. So these men, the 3 of you together, have worked to help correct that imbalance. And so you guys are going to talk to us about your solutions tonight, what you have been doing together. So let's start with Dr. Sutton. And I thought, for people who might be a little confused by this word, when you talk about health equity, what exactly do you mean?
I think that's a great question. And so what COVID did, as we talk about COVID, it taught us a lot about what was taking place, something that we already knew. We knew that when some communities catch a cold, other communities catch the flu. And so there shouldn't be those kind of disparities. Everyone should have, some equity about certain things. And so what, I will say this is that leadership really matters. When COVID started, our state health officer, Dr. Thomas Dobbs, created a health equity unit, a health equity task force to address the COVID issues around Black and Brown communities. And so we started moving towards that end with a number of different initiatives. And one of them I want to touch on a lot of them tonight, but one we're just really excited about that's been real special, and that was some of the shots at the shop. So it was an effort to understand that certain communities are often overlooked, and some communities are often have special needs that need to be reached out to, and that we learn from, and some oftentimes are overlooked. So that was some of our charge in trying to address some of the equity issues around this COVID and the COVID disparities. And early on, it was testing. Later, it became around vaccination.
And just a quick follow to that I think I hear you saying, but my sense is that this is kind of a new conversation in a way on the state level for Mississippi, and you are saying, right, that COVID really kind of created the opportunity in some ways to have this conversation. Is that right?
Donna, I think it's a great point, and I'm gonna kick it a little bit to Dr. Chico. So when we started, trying to develop our health equity office, and so we've done some equity work in the past, but we really was trying to develop and make it more robust. And when we started that, and Dr. Chico accepted the position to become director for health equity, it soon became COVID equity. And so a lot of our work went towards that space because that was the most critical thing that our country and that our state was kind of facing at that particular time. And so I'll let Chico kind of expand on some of that, if that's okay, Don.
Sure, please do.
Yeah, and I would say health equity is a new conversation. I think we've just shifted the conversation. I think previously in the past we've talked about health disparities. And that's really looking more so of those health outcomes, and then really more so of the negative things. But health equity kind of really more so looks at it from a comprehensive focus, looking at, all right, what gaps exist, but what are some of those resources? What are some of those opportunities that we can take advantage of to close those gaps to make sure that everybody has access and opportunity for optimal health? That's really what more so of our goal from an agency perspective. And so, like Dr. Sutton said, we shifted from looking at how do we create a health equity office to now we're focusing on COVID equity. But COVID has taught us a lot. It taught us about a number of different issues that we've had as far as, gaps and issues that we have as far as capacity. It really educated us on opportunities that we could take advantage of, most keenly about those different partnerships and how important those partnerships are in the work that we're doing, especially from an equity perspective, and getting the voice of the community to help drive, again, that work around equity and looking at how do we close those gaps that exist between different communities.
You know, one of the things I noted, I said on Twitter when I saw this story, Mr. Portis, was I was like, here come Black barbershop saving us again. Like, they saving us. And one thing I think is really interesting in your story, and then I'm going to actually get to the point, is I think sometimes we have this, either you go to college or either you learn a trade way of being. And I'm not saying one way or any way is right. And I think it's really important to see that duality in folks, that you've learned this skill, but you also now have training to run a business, to do graphic design. Like, you've got a more holistic view. Not that either one is right or wrong, but I think when you have somebody like you, and I'm a young person sitting in the chair, you can speak to both sides of that equation. So I think that's one thing that's really important, because y'all know my tagline: you don't believe what you don't see. Talk about, Dr. Sutton, talk about how you worked with these gentlemen on this project, and what you guys hope to achieve, what you are achieving, and maybe what you want to do looking forward.
Kim, I think that's just fantastic, because, you know, you talk with the same enthusiasm that I talk with when I talk about working with our barbershops and beauty shops all over the state. But, you know, historically in African-American communities, we all know the role that barbershops have played. Before I lost all of my dreadlocks and all my long curly hair, I used to go to the
back in the day.
That's right. And, you know, but I still had to take my son to the barbershop. But I just remember coming up early, being up in there early Saturday, and I would hear everything that was going on in the community. I would hear about the politics, and you have long-standing relationship for years and years with your barber. And so there are institutions in our community all over the state. So, you know, a number of different programs that we saw this opportunity to work with our barbers, because they're trusted. They're trusted individuals and family and family institutions in the community. And so we saw that as a system. And so prior to working on this COVID, we worked with them around kind of being more health ambassadors, being more working with them around knowing that African-American men are some of the last ones to go to the doctor. Men in general are the last ones to go to the doctor. Your arm almost has to be falling off before you go and get a checkup. And that's just getting regular checkups. So working with Mr. Portis and others, they were able to, you know, first start off doing more hypertension checks and blood pressure. And he has a blood pressure monitor in his shop, and that I'm sure he can talk a little bit more about that. But working with that was just amazing. And so when COVID came, we saw the opportunity to do this shops in the shop program, because it was just because they have the ear to the community. They know folks trust them, and that kind of thing. So we were really just kind of excited on some of that. And Ms. Portis may want to expand.
Yeah, definitely, man. And so just to add on to what Dr. Sutton was saying, is that we started with the healthcare screenings, where we did the blood pressure monitors. And when COVID hit, it got to a point where a lot of people did not want to come to the barbershop, and it put it threw a monkey wrench into the whole blood pressure screening situation, because people were now more concerned about COVID more than anything. And at the time, there wasn't a lot of information out there about COVID. It's still very new right now, even with the new variants. So people weren't interested in getting their blood pressure checked. If they wanted to come to the shop at all, they wanted to come, not be around a lot of people and get out. So when Dr. Sutton talks about it opened way for the shots at the shop, what it did for us was it brought up the conversation about what is going on out here. What is COVID? What is the vaccination? And what could we do? Because people were buying all types of masks. We know people were experimenting with all types of solutions before the vaccine dropped. People were saying what they were going to do here and there. And now we have the shots at the shop. And so one of the most important things for us was to get information about it, because I'm not a doctor. I'm not in the hospitals. I'm not on the front lines. I hear my people's concerns. I hear their confusion. I hear the myths. I hear the misinformation as well as the good information. And now at the shop, the opportunity presented itself where we can find some information that we trust. We can find some information that we can compare to the information that we got. And it's not a vaccine hesitation shaming type thing, but it's about being freely giving information to your clients that would benefit them and allowing them to make the choice that they choose. But you can sleep easy when you have a community who trusts in you and you have information that you trust in and that you can give it to them and allow them to make their own decision. And so that's the essence of what we do. That's the epitome of, what the brothers have created here, with starting with the blood pressure screenings and it evolved to the shots at the shop.
And Mr. Portis, what were you hearing from folks? What were fears? Like, were they like, oh man, I don't know about that. Because I think what we don't understand and what's not reported out well is that fears in the white community are very different from fears in the Black community about the vaccination. What were you hearing?
I heard a number of things. I heard that we were, being tracked. They were injecting us with infertility. And even right now, you have some information with athletes and stuff having heart attacks. There's a video what's going on. One of my brothers from the shop was getting his haircut today. He pulled it up. What's going on? And it's showing all these athletes who are having some type of cardiac or some type of heart problems playing sports. The tracking, the infertility, just from the whole thing, they try to kill Black people. They just, hey, we don't trust it, and so and the list goes on and on. What are they doing with the shot? The shot is experimental. It hadn't been tested enough, and so we went from, at one point when they said the vaccine was going to be available, and it wasn't available in masses. So people were like, hey, we want the vaccine, but I don't think we're going to be able to get it. And then as soon as it was available, I don't trust it, And so these fears, these hesitancies come from different experiences, different information, different influencers that all these people have in their life. And so in the African-American and ethnic communities, we have not had a great relationship with the government, not had a great relationship with healthcare in general or in particular. And so we're always, in most people in the African American community are put in positions where they feel that whatever is given to us is an experiment. Because if you understand the low income areas, when a person is making low income and they shut the city down and they shut your state down and your bills don't stop. And now I don't know what COVID is. I don't know what it's doing, but I do know I have to work. I have to provide for myself and my family. And so every time I go out to work, I put myself at risk. So now if I take the vaccine, or I'm told that it would make me better, or it would make everything easier for me. And at the same time, I don't trust the vaccine. And I'm just speaking on early on notions. And so you had a lot of people who yielded over to the vaccine without truly trusting it. But hey, man, I got to work. I got to take care of my family. And now we're getting towards more of a mandatory mark in some businesses where, hey, you get the vaccine, or you get tested, or you lose your job. And a lot of people, it's their journey. A lot of people are still on this journey of finding them, of figuring out. And so it pushes some away when you at a point where they could be in their journey where they could be ready to yield over, and now you try to force them, and you trigger those feelings that are oh so familiar when the bad things happen, And so but these are the things that I hear. These are the things I experience, and these are the things that my clients share with me on the hesitancy end.
And I know, Dr. Sutton, you had some, you wanted to say a couple things about the myths that people were encountering.
Yeah, I was just going to say, it always brings me to the point of early on hearing about, at one point in time, that Black folks couldn't get COVID. I remember getting information and data that Black folks couldn't get COVID early on, and even sent me maps showing about Africa and some of those kind of things. So, it was a lot floating down, and there's been things now, and there's going to probably be different things on down the road. So we just got to be prepared for it. I mean, we understand that we have a history of some bad things happening to African Americans from the Tuskegee experiment and other issues and disparities as it relates to treatment that's well documented and some of those things. So we understand that, but we also understand that things have evolved and that there's more folks that are a part of these processes, and some and that there was Black and brown folks that were part of the solution in dealing with the vaccine and dealing with developing some of the test kits and some of those kind of things. So, we just have to be constant. We appreciate shows like this to get accurate and correct information. We appreciate the write-ups to kind of help get accurate information out there. And, partnerships is just kind of where we at. Dr. Chico mentioned that earlier. The barbershops are just excellent. We've worked with a team called Crush COVID. That's a health as well. And so, we're just going to have to stay really diligent in doing and getting the word out and moving forward.
Yeah, and I encourage everyone to go back and listen to or watch our program with Dr. Kimberly Smash and Dr. Nina Washington, where they really talked about the science. Dr. Smash is a family practice doctor, I think, and Dr. Washington is a pediatric rheumatologist. They really talked about the science and how this was not new science and how it had been used to treat cancer and other things. So for anybody that has concerns about the science behind the vaccine, that was a really helpful program. And then the one thing I always say about the tracking is, they can track you with that thing you're walking around in your pocket. They know exactly where you are at all times. Right? They know where you are. They already know. They don't need to inject you with anything.
All right, Dr. Udemgba, we keep hearing that, COVID-19 interventions that have succeeded are frequently built on health partnerships that predated the pandemic. And I think you kind of referred to that earlier. Can you speak about the pre-existing community health initiatives that you led and participated in, and how you adapted, specifically how you adapted those for this coronavirus era?
Yeah, it's great that we didn't have to reinvent the wheel to do a lot of this work. And so it was really important that we took advantage of the things that existed and just built upon those different things. One of the things that we know has been a staple in the state of like Mississippi, where we're in the Bible Belt, right? Those partnerships and those connections to our faith-based communities were really important. And so we have a number of faith-based initiatives that already exist. We have congregational health nurses. We have a faith-based initiatives that really go and speak to health overall for our various communities, but more specifically our minority communities. And since those were already established, it was quite natural and easy to tap into those same groups that are already interested in health, interested in improving the health of the community, but also are already trusted voices. And so we know our faith-based leaders are our trusted voices within the community across the board, and taking advantage of that understanding of how do we walk through health and understanding was key and important. And so they were really great and ready to jump on board to take advantage of this opportunity and their voices to then also transition to be as helpful as they possibly can, whether they were hosting testing sites or they were hosting vaccination sites or providing educational information or even passing out PPE, understanding that, certain constituents, certain groups did not have access. It was really key important understanding that, in a state like Mississippi, we almost have a church on every corner. And it's really hard pressed to not go to a place and not be able to find a church. And so knowing that those things exist were really key and important. Looking at things like, or institutions like our Head Starts that are all over the state, that are within the community, they're well respected within the community. We already had, again, those key partnerships that already took place around child document protection and the car seat program, and then transitioning that, again, for during this time where we're in sheltering in place, and transitioning the opportunity while people are waiting to get back to normal, to then also educate and create access around COVID resources, whether it's PPE, again, testing and vaccination as well. And I would say another key piece, of course, was our Mayor Health Councils, looking at those local health officials whose voices are well respected. We understand their position, and their influence, but also they understand their duty to the community to make sure that they're protecting the community and making sure that it's healthy and has the necessary resources. And then, of course, our initiative and our work that we've been doing with the barbershops, and now the Shots at the Shop program adds our beauty salons as well. So now we are able to work with, again, those trusted leaders, those trusted voices, and making sure that we take these programs that exist to the next level. And so utilizing those opportunities, those key programs that already exist, those key voices that are already leaders in health, that have an understanding around health, and transitioning and adding that extra piece of COVID-19. And we understand that just because COVID-19 is here doesn't mean that those other issues stop existing. So this is just the extra layer on some of the things that they're already doing, so that, again, we have that holistic approach of making sure that our community is fully healthy.
Did one of you want to add something to that? I almost felt like.
I think Dr. Chico hit it right on the head. There was things that we built on, and let me just say this: our community partners, they stepped up to the plate. We had in Mississippi, we have a lot of worse firsts. I mean, we have a lot of opportunities to get better, but just to be one of the leaders in the country around the vaccination shot tells you how important it was in the community. And that was a partnership with community health centers, with our faith-based churches. Our historically Black colleges and universities were fantastic. Our community-based organizations, we work with work sites. I mean, it was just really absolutely amazing by the way that we had folks really step up to the plate and really support statewide in really trying to address this issue, get the accurate information out, and supporting everyone. So just really a fantastic job all around the state. We just kind of help do a lot of things, but none of this would be possible without those strong partnerships that we have working out with organizations such as My Brother's Keeper and some of the other G.A. Carmichael, and just some of the others that's all around that has really just been really doing great work. And I can't say enough about the barbershop partnerships and just to touch on that just a little bit, Mr. Portis is really modest on the work that he's done. When we talk about barbers, I've heard him speak, and he'd tell you that sometimes he's the first person to show a young boy how to tie a necktie. He's expected to be at a graduation. There's just really entrenched connectivity with our barbershop program in the community. And if you ever want to have a good laugh and you want to hear things you never heard before, go hang out in the barbershop one Saturday.
Hey, in the beginning of the Jackson Free Press, which is the newspaper that Kimberly and I worked together for 13 years before we did this, my partner Todd and I set up all our distribution spots around the city, and we visited lots of barbershops and heard lots of great conversation as we were doing that. and I will never, we only did it for several months, but it was kind of a wonderful experience, especially as the barbershop folks got to know us. All right. Would let us know what they thought about what we were doing in the newspaper.
See, but I would imagine that you hear the same thing in the salon. I just never hung out in the salon before.
Yeah. No, right.
It's where you get all the tea, the barbershop and the salon. That's where you learn what's really happening.
Yeah.
I want to go back to something that Mr. Portis talked about blood pressure checks, and can you talk a little bit about what that journey is like? So because I know you're starting to get back into that business, for lack of a better. So I get my blood pressure; it's ridiculous. What do you tell me then? What happens? How do you get me out of the chair into somewhere for help?
Okay, so if your blood pressure is ridiculous, more than likely before we got to check your blood pressure, I've already asked you a few questions. I found out whether or not you got health care. I found out whether you had insurance, whether you got a healthcare provider, whether you have a doctor. I found out a few some pertinent information. So if we see that your blood pressure is extremely high, extremely low, the first thing we're going to do is your form is relevant, but I'm going to go ahead and recommend that we contact someone immediately. And I mean, that could be an emergency, I would more than likely contact the ambulance, or I would recommend that we go to some type of emergency room immediately, because once your blood pressure is too far on those extremes, you're in a life and death situation. And there are stories where people have left the barbershop and died. And one of the things that really intrigued me about the program and drew me in was when I went to the forum to listen to the testimonies from the brothers in Udemgba, Mississippi, of how they conducted the blood pressure screens in their shop and the things that they experienced and the lives that they saved. And there was one in particular case that really drew me in when they took the blood pressure of a client, and his blood pressure was so high, and they ended up contacting an ambulance or getting him to the doctor. And when he got there, he later found out that he would have died. So if I'm able to just take one blood pressure screening and save the life of one person, it's worth it for the last 5, 10, 20 years, or however long I'm able to do it. And even since I've been doing it, I've had instances where I've had clients who understood their blood pressure conditions, but when we checked it in the shop, they went ahead and contacted their doctor and found out that it's abnormal now. I need to do something different. And so I've had those testimonies, and I've had a lot of brothers to get their blood pressure under control over the course of the last year, almost 2 years now. They've gotten their blood pressure under control just by having someone to check it, or someone to pull their coattail when they come to the shop. You know, every few months, man, hey, you come here, what's your blood pressure looking like? And a lot of times we need that, and we don't have that type of accountability. As brothers, as African Americans, we have accountability for taking care of our family, taking care of our kids, showing up, you know, on our job and being accountable to each other. But the last thing we look at, most of the brothers, is our health, man. I have those conversations every day with clients in here before we leave on our wind down. We talk about our health. Everybody's working for their kids. Everybody's working for a legacy for their family. But what are we doing for ourselves to ensure that we're around to complete that legacy that we're making for our family? And for the longest in the African American community, our health has always been on the back burner, because the way that we're made up, we're always trying to provide. We're always trying to look out. And if I have to go to the doctor and the doctor tells me I got to sit down, then how do I feed my family? So I don't want to hear that. I don't want to hear that. But the truth is, I need to hear it, and I need to hear it from someone who looks like me and who struggles like me and understands that, you know what, if I want to get to the next day, if I want to see a future for my future and for my kids, you know what, I need to go ahead and sit down and evaluate myself. And that's just something that naturally we don't put together in our community. It's cool if I played football or basketball, if I was that $1 million in the sports, because I'm an athlete, I naturally get checked up. I naturally get looked at. But if I'm not in that small percentage that is an athlete, I'm working in a hospital, I'm grinding every day just to make sure I can take care of things. And that's not something that I think about, because it's never an issue until it's an issue. And when it becomes an issue in my life, we're usually at the end of the road.
Huh. Dr. Sutton, you had something you wanted to add. You want to do some real talk. You want to look in the camera.
Well,
say the brothers with some real talk.
You know, I wanted to tag in because, you know, when we talk about barbershops, there's a lot of real talk that takes place in there. And so, and there's a lot of honesty that takes place that you might not get in other places. And it reminds me of what when Mr. Portis was talking, you know, that in African American men with some of our focus groups and some of our conversations, it's like, listen, you know, I heard that pill message with your manhood, and I'm not gonna do anything that's gonna mess with my manhood or impotence or anything like that. So, you know, I take my chance with the high blood pressure. And so, you know, talking to the barbers and barbers being trained, they say, listen, it doesn't have to. You can try different pills. There's not just one pill. There's other pills, and there's different things you can try to mitigate some of those things. Some of those And that's not an absolute. It doesn't just affect just because you take high blood pressure medication doesn't mean you're going to actually have that side effect, but you can. And there's ways to kind of address some of that. So, that's what I really think is really benefit of a lot of the community partners and having safe spaces to have these kind of conversations and go into the community.
Yeah. And I want to add to that piece as well. When you talk about, the barbershops, and it's a part of the community, right? And so a lot of places you go into a barbershop, it's cut a couple of generations of heads, right? So you got grandfather, fathers, sons, nephews, and things like that. And so that trust that's in there. And then also you can have those conversations. Well, your uncle so-and-so died from high blood pressure. You had a cousin that also died from high blood pressure. So now they can tap into some of the historical things and say, hey, this is why it's important. So those barbers' voices are really key important, but it also ties the picture together. And sometimes you need that big picture for people to kind of get it and understand how it connects. And so that's the other part of the key piece of, again, these shops that are ingrained within our communities that can have those conversations, because it really is tight-knit. And then you have that trusted voice, sometimes more trusted within the barbershop, because you got a lot of YouTube University graduates in there that graduated from med school from YouTube University that come in and have these conversations and talk about it, but people trust them. And so how do we balance those different things out? And of course, when you have a program like this, it lends to the credibility of those barbers, but it also empowers them to be able to have those conversations. Because sometimes we do shy away from that. When you're uncomfortable and you don't know that information, you want to kind of stay silent. That's none of my business. I don't know anything about blood pressure, or I don't know anything about the medication. So I'm gonna stay away from that. You don't have those conversations, then all this misinformation kind of starts floating around. And then, we have those issues where, it continues to get bigger and stronger and deep rooted in the community. And so we're really looking at how does this combat that, and the work that Mr. Portis and our other barbers are doing really kind of helps kind of address those different issues.
I think one thing that's interesting, Mr. Portis, I know you cut a couple of my friends' heads, they're MDs, and it's always helpful that you've got all these layers of the community in there. Mm-hmm. Like they go, Doc said you need to do so-and-so. They go, so-and-so, he says you need to go to truck driving school. You need to get out there. It's just all these layers that you have, all these resources that you can rely on and really have some real talk, Mm-hmm. Now let's talk about, I don't know, young people. How are young people feeling about the vaccine?
Our young people are young people. Young people feel invincible, right? I did. Young people feel invincible. But I have some younger clients that have gotten the vaccine. I got a case in particular. He got the vaccine, and afterwards, sometime after getting the vaccine, being fully vaccinated, he contracted the coronavirus. And young brother, he's at Jackson State University. However, when he contracted the coronavirus, it was very mild. I mean, I cut his father's hair as well. And his father called me and let me know, hey, look, my son, he's gotten COVID. My family's been vaccinated, but we're all getting checked again. And he said that his son came home. He could tell that his son was just under the weather. And he asked his son, how's he doing? Man, I'm all right. I just got a little cold, and it lasted for about a day or two. And because of the environment that we're in, that's something that we don't overlook, right? So they said, look, we want you to go get tested. And he was reluctant, and he went to get tested, and they told him he had the coronavirus. Again, he'd been fully vaccinated. The whole family got checked. They didn't have any issues. And I never forget the report they told me is that, he was fine. It didn't affect him, I mean, he literally was just going on. You could just tell he was under the weather. And so I said all that to say that with the young people is that, they have this invincible mentality. And so those who do believe in it, those who do choose to do it, you still have the other end that's still very reluctant, because there's a lot of information out here. And just to backtrack a little bit, even on the trusted voice that we have, and Chico was saying that, and me being a barber, my father taught me how to cut hair. So I never had a long standing relationship with a barber because I've been cutting my own hair since I've been in 8th grade. So learning the true value of relationships with clients has been something very new for me. to see the value, because going through college, when I wanted to go out, I never had to say, oh, I gotta go to the shop, I gotta figure out when I'm gonna get my hair cut. I just walk in my room and cut my hair. And so cutting hair in the dorm, I didn't get how people would be like, man, I need to get a haircut, and I give them a day and a time, and they'd be like, you gonna get me? Are you sure? Because I've never been let down like that. I never had to go somewhere without a haircut. So now
you had a bad night because of a bad haircut.
Yeah. So now I do get it. I get the trusted voice. I get it, and I see the big role I play in people's lives. And my backtrack was this: we talk about the trusted voice. The biggest issue that we do really have in the African American community too is we miss that trusted voice because of the how the deaths that we have among African American men. My case included. I never met my father's father. I don't know what my father's father died of. My kids never met my father. So I know my daddy died. He was a diabetic. He had bad health. And I remember sometime years before he died, before I went to college, when he was telling me about his conditions, he would say, man, nobody really told us, about health. So when I was out here working and taking care of the family, we would just eat whatever we could get to keep going. And down the line, he had to suffer for those decisions that he made. And some of them became irreversible. And so my father, I'm sure, trusted his father. And my dad, even for lack of perfection, I still trusted my father. I trusted his advice. I trusted his presence. But through those periods, I didn't get to meet my father's father. My kids never met my father. And so now that I'm in my 40s, I'm early 40s, I just turned 43, I don't have a real trusted voice that I came from their loins to give me advice, right? I have an older brother who's a doctor that I trust. And so and I have clients who I've cut their hair and I've watched them, I've cut their hair and I've seen their father die while they're in high school. And then I become the only man that they trust. I've had clients, I've cut their hair and I find out they don't know who their father is, and so you begin to figure out why we are how we are, because we don't have a true relationship that we can truly trust, that we don't see anything without personal gain. And so we have to protect ourselves and protecting our family and protecting our bodies. And so, man, in the African American community, that trust is very hard. And once we get it, we cherish it. And once we lose it, we've lost it. So that makes this very important when it comes to the shots at the shop, when it comes to the coronavirus information, because when I talk to my clients, I gotta first, because I understand the trust barrier. A lot of times I deal with the negatives of the vaccine before I deal with the positives. Because if you don't give them the negatives, they feel like in our community, I feel like you're hiding something from me. You're telling me all this positive stuff about it. You didn't tell me any of the negatives, right? And this is something that we have in our community, and it does hurt us. It does hurt us. So I just wanted to say that, the trust factor and just the whole, how that trust plays out in the community just through my eyes and what I see.
One of the things that we know, and I think this statistic is still true. One of the things Dr. Dobbs talked about when he was on the show, and I'll kick this over to Dr. Sutton, is that Black Mississippians have done a good job of getting vaccinated. And when you think about it, it's pretty fast, because we went from a pretty reticent community to a community that was willing to get vaccinated. Besides shots in the shop, what other programs have you guys seen? I know churches have done a lot of heavy lifting on vaccinations. How did you, Dr. Sutton, how did y'all get leaders across the community to hear you? Because I was reticent, but I got 20 friends that are doctors, so I can call somebody.
That's right.
I mean, that's a lot of privilege. I can call somebody. I'd be like, you got to explain this to me. But how did you get buy-in from other folks?
That's a great question, and I do reckon, and please recognize that everybody don't have those strings you got, and that's a blessing. I mean, it's a blessing to be able to pull those strings. But, let me say this, and I mentioned this earlier, leadership really matters. And it's one thing to be able to have this team and that what we were trying to accomplish. It's another thing to have Dr. Dawes move those to make it a priority and to move obstacles out the way so we can be nimble and we can move. And it's also another thing to kind of listen, because one thing is that, oftentimes people have all the answers, and that's not really the case in working with communities around the state. You got to go to those communities to find those answers. So a couple of things I want to mention about other projects that we had, and some of the lessons learned is that we have a community vaccination program. So we found out early on is that, you can have these testings and have these taking place, but if the community is not aware of it, if the community doesn't know about it, if it's not even located in the right place, you might not get the community to come out to it. And so we've learned that over this whole process. We mitigated that by having a equity team, having a strike force. You can give us a call and we can go to any place in this state and provide a vaccination event. And I think that was pretty amazing that we could do it at the church, we can do it at the community center, we can do it at the Head Start Center, we can do it at any place that you want to have an event. We can come out and do a vaccination event. And I think that was pretty powerful, and that was made possible. So we had that partnership in place. We had those partnerships with the community health centers. We also had media campaigns that were targeted to our community, that was targeted to various communities. And just even the media campaigns were actually produced by minority vendors. And that was a little different, and it makes a difference. We had folks that understood the communities they were trying to reach and worked with us to make sure that the messaging was accurate and the messaging was correct. And I want to also mention that we had a Hispanic task force. We had a Vietnamese task force. We had folks that in those particular communities to tell us what we needed to do, how we needed to do it. Just a quick anecdote is that we learned real quick that we were wondering, we were having these events and we wasn't getting our Latino brothers and sisters to come out. Where, they found out and we found out that, when our state suffered from one of the biggest raids that you can ever come across around ICE. And these folks were dressed the same way. And so we had to work with community-based organizations and Latino-based organizations in partnership to make sure that we can get the message out. And it wasn't a bad thing for us to change the garb and go to the uniform. Instead of being in camouflage and that kind of thing, why not wear a shirt with the Mississippi State Department of Health on it, or something different to make folks feel more comfortable? And just in closing on some of this, we even learned in one community, we had a vaccination event that was in Hattiesburg. And so there was a low turnout of African Americans and Black and brown folks. And then you ask the community, like, listen, we don't go over there. We don't go over there. It's on the other side of the highway. And so, no. And so you have to, we have a lot of issues and problems in the community, but that's where all the answers are. And so our leadership understood that we had to listen, and we had to work at that ground roots level, and we had to work at partnerships to really accomplish it. And I think that has manifested itself into some of the numbers that we've seen today.
Dr. Udemgba, I think I want to address this to you, but anybody who wants to jump in here, please. When y'all talk about all of this, I think about this project that we're doing, this reporting project, the Black Women's Systemic Barriers and COVID-19 project. And our whole point of that project was because COVID hit Black women so hard in early months, and we're a women-founded publication and such, we really wanted to kind of use it as a way to figure out the variety of systemic inequities and barriers that kind of existed that then made it more difficult for Black women early on. And what I'm getting at here is that we're kind of using it as a way to explore interconnecting inequities that then can have an effect on education in Knoxville County, or even safety and crime and violence in Hinds County, or healthcare access in Holmes County. Those are our 3 counties. So the reason I say that is that to ask, well, or to really just get you to talk about how inequities interconnect, particularly like in the example of health equity. What are other kinds of inequities, disparities that then create worse health outcomes?
Great question. And I think one of the biggest points that we've learned is that COVID-19 came and it just kind of stole the show. But just because COVID-19 is here doesn't mean that all these other issues stop existing. And so just because you have COVID-19 doesn't mean that you stop having diabetes. Just because you have COVID-19 doesn't mean that you stop having hypertension. Just because you have COVID-19 doesn't stop meaning that you need to have access to healthy fruits and vegetables. And so one of the things that COVID-19 has done is really highlight a number of different health inequities that exist. And these inequities are interconnected. And one of the things that we talk about is social determinants of health. And those social determinants of health are really those key factors that drive those health outcomes. And so most of the time when we talk about health disparities, we focus on those health outcomes. We focus on the end result. But the social determinants of health are really those pathways that get us to those end results. So why does a person have diabetes? Why does the person have hypertension, and so on and so forth? And so if we look at those social determinants of health, it really helps us build a bigger picture of what type of inequities exist that drive us to those different things. So we know that people that live in poverty are more likely to have certain health outcomes. We know people that aren't as well educated tend to have those same health outcomes. We know that people that live in violent neighborhoods tend to have poor health outcomes. We know that people that have lack of transportation, people that have lack of stable housing, having unstable jobs, and all those different things are interconnected. And the more you add to it, the worse your outcomes are going to be. And so you talk about adding layers. And so if you're a person that didn't have a really good education, then you probably don't have a decent job, which probably means that you don't have access to reliable transportation. It also probably means that you probably don't have access to stable housing. And if you're in a housing community or network that's not really safe, then you're unable to have access to stable food, or you're probably living in food insecurity, and all those things add up to where now you're dealing with stress. And that stress, we know stress has a number of different issues, not only for individuals from a mental perspective, but also a physical perspective. We know that mental and physical opportunities, issues coincide with each other to gain overall from a overall human perspective and overall health perspective, drives those health outcomes to worse issues as well.
Well, and what I think is difficult, and that part of what we find is that people are overwhelmed by that knowledge sometimes, right? It's like, well, there are all these different problems, and how can we tackle more than one at a time? One of our reporters who's working on the Hinds and the crime and safety one, she and I were talking to Mayor Lumumba today, who was talking about disparities and how they intertwine like this. So I guess here's the hard question. I mean, how can we convince people that it is possible, to deal with what can seem immense to them? I think in that way, when we're talking about these kinds of quote root causes, or whatever, whatever we want to call them.
Right. I think the concept is understanding that a lot of these root causes didn't happen overnight. Right. We didn't just wake up one day and these things just happened. Over time, a lot of these things took place. And so when you talk about things like systemic racism and how that's driven, issues in access to housing, how that's driven issues to access to resources around education, how that's driven to access to things like grocery stores and things like that. And so what it's going to take is, a commitment not only from public health and other individuals, but us as a community and as a state to really prioritize closing the gap on a lot of these inequities. How do we come together and address these issues? And there's going to be different sectors, and so how do we prioritize? And each sector can step up and say, hey, if I'm from the transportation sector, then it's my responsibility to figure out how do I close these gaps in transportation. If I'm from the food sector, how do I really increase access to foods? And from the healthcare perspective, how do we do that? And so it's really going to take a concerted and we really have to actually take it seriously and put forth real effort in order to try to close that gap. And that's going to take a community effort, not just that's the health equity's responsibility. That's the health department's responsibility, but it's our responsibility as a state to really kind of step up and try to address these issues.
Well, and it does seem true, right, that if we are dealing with different systemic problems, that the solutions are also going to be interconnected. Like if you're working on one solution, then the effects that it would have would be positively affected, I would think. I mean, that seems logical, right? So I guess we're getting kind of toward the end of the show here. So what I would love to hear from each of you, maybe just what's some advice, like as we're kind of going forward through these dealing with inequity and systemic issues, and what would be your call to action to the community or to other people who are in a position to help do something about this? Dr. Sutton, you want to take that first?
Sure. That's a great question. And I guess I get two answers to it. One is take control of your most valuable asset, and your most valuable asset is your health. Okay. The car you drive, the money in the bank is not going to matter. None of that's going to matter if you're not healthy enough to enjoy any of that or be around or what have you. And we have the opportunity to take control of our health. And so let's please take responsibility and do what you can to improve your health. The other piece of that is that, you raised a great question. It's very complex. And health is a part of education. Health is a part of housing. Health is a part of what you have available to you. And so we want to just be conscious of these issues. Understand about issues around disparity and bias and implicit bias and some of those kind of things as we look at just a greater society and stuff. And just be aware, and let's do what we can to kind of improve our health for the whole society.
Mr. Portis.
For myself, I would just say it would definitely be some of what Dr. Sutton just said. Taking control of your health, taking control of the information that is given to you, weighing those things out and seeking out the truth. And I understand, even with what I deal with, there's a lot of people just don't trust all information. But in this world, you're going to have to trust something. You read your Bible, it'll tell you you're a fool if you don't believe in God. And the other people will tell you you're a fool if you believe in God. But at the end of the day, you got to be a fool for something, right? So, yeah.
I love it. And Dr. Chico.
I would say that the call to action is really looking at what resources do you have to offer, and taking advantage of that in that arena. Start where you are. Start within your own community and allow it to expand and grow, and take advantage of not only that, but also utilizing your platform, utilizing your voice. We all have some type of voice, and it might not be as big as others, but even if it's a small one, it still means something. It still matters. You don't know who you might touch, and if you're taking advantage of utilizing that platform and that voice, you might be improving the health and saving somebody's life that you didn't even think about before.
Wow. Well, gentlemen, I wish we had another hour, because this has been a wonderful and informative and remarkable conversation. Thank you so much for the work that you do, each of you, this collaboration. It's very inspiring, to get people even thinking and talking about these issues. So thank you very much. We appreciate your time tonight. We keep us posted, because we will report what's happening next as you go forward, even past COVID-19. What do your equity efforts look like then. And cheers to Dr. Dobbs for giving you guys the space to do this. I'm glad you called that out, because it sounds like a lot happened since COVID on this front, and the seeds were planted. So that there's hope in that. So thank you very much for doing that. And thank you, as always, Kimberly, for being a fabulous co-host. Yay. And to the rest of you, remember that you can still see the show on YouTube. You can see it on Facebook Live. You can share the show. Please do, because I think this is a particularly important show. So please get it out there. Tell your friends to watch. Let's just kind of keep this conversation going. And please pay attention to to follow the Black Women COVID project that I was talking about, mfp.ms/BWC, because as we're dropping the work, we're going to start dropping Hinds County work that I was referring to next week. That's related to safety and public safety and crime in the time of COVID. And so we've got lots more coming in that project, and it's doing exactly it's talking about the kinds of issues that these gentlemen were talking about tonight. So please pay attention to that. And as I always have to ask, please support our work at the Mississippi Free Press. We're a nonprofit, and we happen to be in our end of the year fundraising campaign so that we can do more systemic journalism and investigative reporting. And we thank everybody for your help so far. It's been amazing. Right now, we're in a campaign where we have for another $10,000 at least, we're tripling. They're triple matches of everything you donate up to $1,000. So that's a pretty cool thing for our News Match campaign. So we will see you guys next week. Again, gentlemen, thank you so much for being here tonight.
Thank you.
Thank you.
Thank you.